Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to cover low back pain and the contributing factor of weakness in the gluteal muscles. I'm going to speak about how weakness in the gluteal muscles contributes to low back pain and what you can do to help to eliminate this contributing factor. Low back pain is quite common. So is weakness in the gluteal muscles. The gluteal muscles are considered part of the core. I already did a video on weakness in the core muscles, but I want to cover the gluteal muscles specifically in this video. And I'm going to speak about two different gluteal muscles. I'm going to speak about the Gluteus Maximus muscle, which is the biggest and most superficial of the gluteal muscles. And I'm going to speak about the Gluteus Medius muscle. The Gluteus Maximus, oftentimes you might hear it just abbreviated to the glute max. I'm going to use the terms Gluteus Maximus and glute max throughout this video. The Gluteus Maximus muscle, when contracted concentrically, in medical terminology, concentric means the positive contraction of the Gluteus Maximus. The Gluteus Maximus works along with the hamstring muscles to perform hip extension. Hip extension is when you are moving the thigh backwards. So again, the concentric contraction of the Gluteus Maximus muscle is hip extension, and it works along with the hamstring muscles. The Gluteus Maximus and the hamstring muscles form the hip extensor muscle group. The Gluteus Medius is located on the side of the pelvis, and it performs hip abduction. Abduction is the proper way to say it, but I like to say abduction just to make it easier for everyone to understand. Hip abduction is when the leg is moved away from the body on the side. So we are standing up straight and you lift the leg straight out to the side along the same plane as the body. That is hip abduction. And that is what the Gluteus Medius muscle performs when it's contracted concentrically. The Gluteus Medius muscle also assists in hip external rotation when the hip is extended, and it helps to maintain a level pelvis when we are standing on one leg, when we are standing up straight, when we are walking, and when we are running. So the Gluteus Medius is extremely important when we think about keeping our pelvis level. Also, there is a muscle called the Gluteus Minimus. The concentric actions of the Gluteus Minimus are hip abduction and hip internal rotation. Weakness in the Gluteus Maximus muscle creates poor posture, incorrect movement patterns, and places an increased workload on the spinal muscles. The increased workload leads to fatigue and eventually pain. Oftentimes, weakness in the Gluteus Maximus muscle is caused by prolonged sitting. Weakness in the Gluteus Maximus muscles are a major contributor to a postural condition known as lower cross syndrome. When a combination of tight hip flexor muscles or a strength and balance exists between the hip flexor muscles and the hip extensor muscles, lower cross syndrome can occur. The muscles which flex the hip, again, the hip flexor muscles, are the psoas and the iliac muscles, which form together to form the iliopsoas muscle. They overpower the weaker hip extensor muscles, which are the Gluteus Maximus and the hamstrings. So this strength and balance leads to a postural fault known as lower cross syndrome. Weakness in the Gluteus Medius muscle may lead to instability in the pelvis. One side of the pelvis may be higher than the opposite side when standing, or one side may raise higher or dip lower than the opposite side while walking or running. The instability in the pelvis leads to an increased workload being placed on other structures, including but not limited to the piriformis muscles, the spinal muscles, the hip joints, the sacroiliac joints, the lumbar spine, the iliotibial band, the hip flexor muscles, the tensor fascia lata, the hip adductor muscles, and the hip extensor muscles. Weakness in the gluteus medius muscles can contribute to not only low back pain, but to a wide assortment of musculoskeletal conditions, including but not limited to lumbar spine sprain strain, sacroiliac joint sprain, iliotibial band syndrome, patello-femoral pain syndrome, also known as runner's knee, hamstring strains, and proximal hamstring tendinopathy. Injury prevention is easier, faster, and less expensive than injury rehabilitation. To prevent weakness in the gluteal muscles and to lessen the contributing factor of weakness in the gluteal muscles causing low back pain, you want to have a training routine that includes exercises that directly targets the gluteal muscles, and also you want to include functional multi-joint exercises that target the gluteal muscles. Exercises that directly target the gluteus maximus muscle are the hip thrust, also known as the pelvic bridge. You could perform this isometrically to build strength and endurance. An exercise called donkey kicks and hip kickbacks. These are the exercises that help to directly target the gluteus maximus muscle. Functional multi-joint exercises that target the gluteus maximus muscle are squats, lunges, and leg presses. You can perform these exercises at a variety of angles and foot positions so that you target the gluteus maximus more. Exercises that directly target the gluteus medius muscle are side-lying hip abduction, side-lying hip external rotation, which is known as clams, and the pelvic bridge with banded hip abduction. Again, the exercises that directly target the gluteus medius are side-lying hip abduction, side-lying hip external rotation, which is known as clams or clamshells. That's an exercise for the piriformis muscle, but it also works the gluteus medius muscle. And another exercise that directly targets the gluteus medius muscle is the pelvic bridge combined with banded hip abduction. The functional exercises, the multi-joint exercises that target the gluteus medius muscle are X-band walking and the monster walk. Again, the functional multi-joint exercises that train the gluteus medius muscle are the X-band walking and the monster walk. If you experience low back pain, please see a medical professional. Get a proper evaluation, diagnosis, and treatment plan. Please never self-diagnose. Always see a medical professional. Once you have seen the medical professional and they have set you on a path to recovery, then you could start your rehabilitation program. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. Always work every exercise through a symptom-free range of motion, even if that motion is very small. If you have weakness in the gluteal muscles, or if you have a postural fault, which is because of weakness in the gluteal muscles, or if you have low back pain or any of the other conditions that I mentioned earlier due to weakness in the gluteal muscles, you want to start your rehabilitation plan immediately. Do not hesitate. You can perform the exercises that directly target these muscles. You want to start with those exercises and then progress in small, gradual, calculated increments to the functional multi-joint exercises. But please start all exercise programs at your current health, fitness, and strength levels. Do not start at what you used to be able to do when you were younger or what you used to be able to do before an injury occurred. Always start at your current health and fitness levels and begin your prevention or rehabilitation program to strengthen the gluteal muscles with the exercises that directly target those muscles. Again, for the gluteus maximus muscle, you could perform the pelvic bridge, you could perform donkey kicks, or you could perform hip extension exercises. For the gluteus medius muscle, you can perform side-lying hip abduction, and you could perform the clamshells, which is sideline hip external rotation. Once you have mastered the exercises that directly target the gluteal muscles, then you can add the functional multi-joint exercises. You can start to perform exercises like squats, lunges, X-band walking, and the monster walk. This is going to help to strengthen the gluteal muscles. And again, weakness in the gluteal muscles can contribute not only to low back pain, but a number of musculoskeletal conditions that can cause pain, symptoms, and limit function. So you want to make sure that you keep your gluteal muscles strong, and if they do become weak, you want to make sure that you strengthen them with a very good exercise program. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report, where I cover the contributing factor to low back pain of gluteus muscle weakness. Again, make sure that your gluteus muscles are strong. This is going to help to prevent low back pain. This is going to also help to rehabilitate low back pain, and it's going to help to prevent the recurrence of low back pain. Plus, it's also going to help you to prevent any type of other injuries that are affected by weakness in the gluteal muscles. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on my book, and you can find my blog. My blog contains articles on chiropractic care, spine health, sports medicine, health, nutrition, and fitness. Please feel free to like this video. Please subscribe to my YouTube page. Also, if you have questions, suggestions, or feedback, please leave them in the comment section below. Always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your goals.